Okay, so it's continuation of Alan's keynotes study streak which we'll be undertaking today. Argentum nitricum is the remedy, and when we open Allen's keynotes, we see the first line that is mentioned is acute or chronic diseases from unusual or long continued mental exertion. So all the people who are working in their offices for long hours, we think of Nux vomica as a primary remedy. But if they are hurried in nature, if they have deadlines to meet, it is as if they have to do lot of work in a short period of time. That is Argentum nitricum. You can think of Nux vomica, but also think of Argentum nitricum as one of the top remedies. Going further, we have always think of Argentum nitricum on seeing a withered, dried up, old looking patients, and that's why we have premature old age people falling into this category. If he is thin and scrawny, think of sickle power. Apprehension when getting ready for church or opera, diarrhea sets in like the remedy gelsemium. So Argentum nitricum is one of the top remedies which we have studied in our college, in our education graduation period for ailments from anticipation, whether they need to do a performance or they need to go somewhere. Even the act of going somewhere causes them uh, so much of emotional disturbance that their nervous system is disturbed and the diarrhea sets in. Time passes too slowly. This is one of the keynotes of Argentum nitricum. We read in all the books, but more specifically, when we come to this point in Allen's keynotes, it is the only part which is highlighted in this area. That is why we come to a person who is having a feeling that time is very slow to pass, and if I need to match that time and I need to cover a lot of things, I need to be hurried in my activities, and that is why we have someone who is impulsive, someone who wants to do things in hurry, and he wants to walk fast. He is always hurried, irritable, nervous. We have a similar situation in Nux vomica, but he is more angry in nature rather than being more hurried or anxious. These are the little things that you will need to observe. One of the things is how the patient looks like, which is the constitution. Second thing is how he is behaving in his presentation of complaints when he comes to us in clinic. Those are the two things which you need to focus. If you have been a part of Allen's keynote study stick, which I have undertaken in the last 50-55 days, bearing the last 6 days where I was traveling, you will see that I have given many little points in each remedy apart from my own observations about the different remedies, when to repeat, how to repeat different cases, and you will get an idea of how it will clinically be seen in your practice. Similar remedies we have for one who is nervous, anxious is Aurum metallicum and Lilium tictinum. Emaciation progressing every year, most marked in lower extremities. So we have ammonium mure as one of the similar remedies. Ammonium carb and ammonium mure are someone who is obese at the top, but at the bottom in the legs they are very thin. Lycopodium is opposite. They are thin in the upper body, but they are dropsical and too much bulky, especially in the lower legs. These are the minute observations that you need to make in clinic so that your remedy is 20% confirmed from your observations. Next 20% will be from the way the person talks to you or exhibits himself in front of you. So that is almost 40 to 50% of your prescription. That depends on observation and how he talks to you. It can be emphasis on certain words, it can be some acts that he will do constantly which will make you feel that he belongs to arsenic, he belongs to argentum nitricum, he belongs to ammonium carb, ammonium mure, he belongs to nux vomica. These are the little observations. So you will need to go and watch again my sessions which I undertook on these specific remedies to understand what I have shared about those remedies. Great longing for fresh air in Argentum nitricum. From Allen's keynotes we have The other remedies being amyl nitrosum, pulsatilla and sulfur. Sensation of splinter in the throat when swallowing. Interesting remedy which we come across over here is Dolichos pruriens, which is a good skin remedy, but it is mentioned over here, so you need to remember it. Hepar sulf, nitric acid and silica. Sensation of splinter is so strong in the uterus also we will find this symptom, especially when walking or riding, and the patient feels chilly when he is uncovered, yet he feels smothered if he is wrapped up. So there are contradictory modalities. Sometimes he wants to cover because he feels chilly, but as soon as he covers he feels that he is wrapped up. This is not to be confused with the state which is present in fevers. Argentum nitricum is very less prescribed in fevers. There are other remedies which you will think of in fevers for such a state where person will take up the covers or remove the covers when he feels too stuffed up. For that, you need to attend my fever workshop, which will guide you to understand how to differentiate different patient symptoms and presentations of different patients in different remedies. Going further, we have Argentum nitricum also craves for fresh air. He craves for sugar. So it is one of the top remedies which we should think of in patients who crave for a lot of sweets, lot of sugars. It can be someone who is teenage, adolescent or someone who is adult also. Next is one of the very important symptoms, and this will be subjectively told by the patient that he cannot walk properly. There is a kind of a feeling that he will fall. There is unsteady gait, especially when he thinks himself unobserved. So when no one is observing him, he will kind of move or shake. But if someone is observing him, he is perfectly fine. This is the opposite of the hysterical remedies that we come across like Ignatia, Moschus, etc. etc. Next you have is headache, which is congestive, fullness and heaviness with sense of expansion. Just go through these symptoms and you will understand how beautifully each component of the remedy is exhibited in the symptoms. So you have this complaint of headache, which is a sense of an expansion. It is a habitual or gastric headache, which is of literary men who are on the desk all the time, from dancing, hemicrania, pressive, screwing in the frontal eminence or temple, ending in bilious vomiting, aggravated from any exhaustive mental labor, better by pressure or tight bandaging. The other two remedies mentioned are apis and pulsatilla. So when you go through this symptom, you see one of the top things mentioned in the beginning is headache, which is throbbing and having a sense of expansion. Now this sense of expansion comes from the nitrate, which is actually a component which is used in lot of arms and ammunitions everywhere, like the remedy glonoine. These two elements are used and they have these experiences of expansion or bursting, and that is why if you know that this patient is complaining of feeling of bursting or something which is opening and shutting or something that is throbbing and pushing outwards, you should think of nitrate group of remedies or glonoine as one of the top remedies. Next you have for eyes, one of the top remedies which we think of Argentum nitricum is in conditions of conjunctivitis. Acute granular conjunctivitis, scarlet red like raw beef. So you need to see the raw beef first and then memorize this symptom. Only then you will remember this. If you are memorizing the symptom and then you are seeing the patients, you will not get to know what's happening. Just have a look, Google and find out what is raw beef looking like. When you find raw beef image, go in the different materia medicas and read about Argentum nitricum. Go to the clinics, ophthalmology clinics or homeopath clinic. When you come across such cases, see the eyes, see the appearance, match those with the pictures, you will get an idea. Once you do that, always you need not do it, it will be etched in your memory. That is what the scarlet red like raw beef looks like, and you have discharge which is profuse mucopurulent. Ophthalmia neonatorum, profuse purulent discharge, cornea is opaque, ulcerated, lids are sore, thick, swollen, agglutinated in the morning. Apis, Merksol, Rustox are the other few remedies. Eye strain from sewing during the sewing work, aggravated in warm room, better in open air. Natamid and Ruta are the other two remedies. Diseases due to defective accommodation. So you will see lot of people who have eye troubles. They develop some issues of the eye. It can be burning. It can be eye strain. It can be muscular involvement of these areas. Think of Argentum nitricum, one of the top remedies. Another remedy you should think of is physostigma. Another remedy you should think of is Ruta. Chronic laryngitis of singers, high notes cause cough. So one of the areas where it is very underprescribed Argentum nitricum as a remedy is in cases of respiratory tract. We have been giving it left, right and center in cases who have apprehensions, anxieties. But this remedy should not be missed in cases of cough, especially those who are habituated to singing or using high pitch sounds, which can cause cough because there is a strain of vocal cords. The other remedies being alumina, argentum met, and arum triphyllum. You will need to find out the characteristic of each remedy. Argentum metallicum must hem and hawk. This is the symptom. It needs to clear this way the throat. Whereas Argentum nitricum does not need to do anything like that, but there will be a kind of a chronic problem which is lingering for a long time. The patient may or may not crave for sugar. That can be a good find for you if you can hit on that target. The patient as a whole, physical generals, which are going to be your prescriptive pointers. I have been emphasizing on those pointers in all the remedies that I have discussed so far. So the patient will crave sugar. Child is fond of it, but diarrhea results from eating it. Craves salt or smoked meat, the remedy is Calcarea phos. If he craves for sugar and he gets diarrhea from it, it is Argentum nitricum. Belching accompanies most gastric ailments. So now it is mentioned in bold and it's also in italics. When you have a patient who complains of 10, 15, 20 symptoms, but there is belching or there is eructation throughout the day which he keeps having, you will probably record it as a symptom to prescribe. But if you pick it up as a concomitant symptom and think about prescribing Argentum nitricum, you will have more success than thinking about it as a mainstream symptom and indicated according to all the other symptoms as well. So consider this, that it is mentioned belching accompanies most gastric ailments. When you understand this, you will see that belching has been a concomitant symptom in many of the cases of Argentum nitricum, and you will find it in your patients also. Flatulent dyspepsia, belching after every meal, stomach feels as if it would burst from wind. There is difficulty in belching also. It's an incarcerated flatus, and the air gushes out with great violence. So there is loud eructations, and there is kind of a stuck up feeling also. Diarrhea is green mucus like chopped spinach in flakes, turns green after remaining on diaper, after drinking, after eating candy, sugar, masses of mucolymph shreddy in strips or lumps with much noisy flatus. So all the children who always have mucoid stools, mucus like stools, and the mother is worried all the time that my child is having stools which are mixed with lot of mucus and we are not able to understand, and the child is disturbed because he also strains and there is lot of gas passing. Those are the cases you should think of Argentum nitricum. The other remedies are Asarum europeum for lumpy stools and Alosocotrina for noisy flatus with the stools. As soon as a person eats, he has to go to pass stools. Top remedies we should think of is Argentum nitricum, arsenic and croton tea. Urine passes unconsciously day and night. Causticum is one of the other remedies. Now, how will you find to prescribe argentum nitricum as a remedy for children who have nocturnal enuresis? One of the things is that you will have a patient who will have disturbance in gastric area. He will have anticipation, he will have apprehension before the exams, before any event which he is undertaking, and he will also have craving for sugar, which are going to be the components. So I have been emphasizing on these components which you should focus on in different cases for you to use Allen's keynotes. Otherwise, there is no possibility that you can make use of Allen's keynotes. You will always follow the method of repetization and you will get stuck up with polycrest remedies or different group of remedies. But if you are willing to use Allen as a prescriptive book, then you should know how to use the different components. Then you will be able to understand how you can use these symptoms to prescribe. In male sexual system, one of the top remedies is argentum nitricum. Everything that argentum nitricum has to do is with performance. So something that has always related to performance. In sexual sphere also he needs to perform. If that performance is not coming through for him, he feels that there is impotence and the erection fails and when the coition is attempted. Similar remedies are agnus, caladium, selenium, but the reasons are different over there. The reason over here is different. Here it is more of apprehension. There it is more of a physical or physiological problem. Here it is psychological problem. Once you understand that, you will be able to prescribe the remedy in a better way. Similarly, for the female reproductive system, we have coition, which is painful in both the sexes, and it is followed by bleeding from the vagina, other remedy being nitric acid. Metrorrhagia in young widows with sterility with nervous erythemism at the change of life, the other remedy being lachesis. So in the Allen's keynote study streak, when we discussed the remedy lachesis sulfur, I had already shared that lachesis is one of the top remedies which you should think of in climacteric. Also you should think of graphitis. Similarly, you should think of argentum nitricum. It is if the person is more nervous oriented or more predisposed to nervous affections and psychologically much disturbed than physically. Convulsions preceded by great restlessness is one of the top things for argentum nitricum mentioned in Allen's keynotes. Great weakness of lower extremities with trembling, cannot walk with eyes closed. So he always wants to walk with open eyes, otherwise he will kind of get imbalanced. And if you think of any differential remedy, it should be alumina in this case. So this will be more of a neurological case which does not have any pathological foci in the body, but it is more of a psychological in nature, and the patient may have got the prescription of psychiatric remedies from the psychiatrist rather than from the neurologist. That should be your way of understanding argentum nitricum for neurological prescription. If he has come to you as a primary physician first before visiting any other physician, you have more chances to prescribe argentum nitricum if your diagnosis is correct based upon your observations of Romberg's test and all the other tests that neurologically you should be doing. Next you have is modalities. The modalities are that there is aggravation from cold food, cold air, eating sugar, ice cream, unusual mental exertion. Those who are sitting for long, for studying for their work, they should be thought of prescribing argentum nitricum. We always think of Nux vomica, we always think of sulfur, but argentum nitricum is never prescribed. So in such cases you should prescribe. In fact, unusual mental exertion, if the person is having more anxiety, you should think of argentum nitricum. But if he says that I am not anxious, but I feel that before examination I may forget something, and in the previous years Just before the examination, I was totally blank. They should be given Ethusa synapium. Give Ethusa synapium 1 m 4 times a day, 5 times a day before the examination. The patient will be much confident, he will be happier, he may not go blank. If he is having more nervousness, then think of argentum nitricum. If he feels that he is not nervous but he feels blank because there is too many things that he has studied and he does not know how to recollect everything, think of Ethusa synapium. Argentum nitricum has amelioration from open air, craves the wind blowing in his face, and he feels good by bathing with cold water. Natramur is a complementary remedy. Coffea will increase the nervous headache of argentum nitricum. And if there are people or young age students or adolescent children who are taking tobacco, think of argentum nitricum, arsenic, and veratrum. Argentum nitricum is very similar to natramur, nitric acid, lachesis, aurum, and cuprum. All these are remedies for various levels of patients and various presentations. I would say it is argentum nitricum is more of like a lycopodium, sulfur, and carboveg combined. And then you have the last line which is mentioned after veratrum, lyco follows well in flatulent dyspepsia. So you can think of argentum nitricum after veratrum album or after lycopodium, especially in flatulence cases where there is more of a gastric problem which is related to neurological disturbances or nervous disturbances and the other symptoms which have been mentioned. Whatever symptoms are mentioned in bold in Allen's keynotes, you need to pick them up, write them in a separate book so you remember it very well, and it will be of help when you see patients, because those are the things which have been proved and reproved in clinics whenever our stalwarts have seen. So that brings us to an end of today's session on argentum nitricum, and we'll continue with the next set of remedies tomorrow the same time, 5:15, 5:30. And if anyone wishes to join my fever workshop, you can join the introductory session which is slated on 5th of August, 5 p.m. It will be from 5 p.m. to 6 p.m. It is a free session, and those who wish to join, you can just comment below this video, or there are various posts on Facebook, Instagram, and YouTube where you can go and put your comment, and we'll send you the link to register. And it will be a great learning. If you are not there, you are missing out on treating fevers in a very beautiful way. So that's all from me now, and we'll meet again tomorrow the same time with different group of remedies which are remaining from our Allen's keynote study streak, which we started from 11th of June and we continued for the last 2.5 months.